county known for its excellence in sport, the arts, culture and its built-in natural environments, which are utilised to promote health and wellbeing in Kerry. The county also has strong interagency, voluntary and community workers that play a key role in community health and wellbeing and addressing health inequalities. The Healthy Kerry Framework, which we are launching today, sets out to support the implementation of the National Healthy Ireland vision, goals and campaigns in response to the needs of the local community over the next 6 years. The vision for a Healthy Kerry is that everyone in the county can enjoy physical and mental health and wellbeing to their full potential, where wellbeing is valued and supported at every level of society and is everyone's responsibility. The Healthy Kerry Framework focuses on 3 priority areas, which are building healthy communities, supporting wellbeing in the workplace and policy frameworks. The Healthy Communities Strategy pillar will focus on acknowledging the health and wellbeing assets in the county and supporting all sectors of society to work in partnership to further promote health and wellbeing in Kerry. The Wellbeing in the Workplace and Remote Working Strategy pillar will seek to promote and support staff health and wellbeing initiatives over the coming years. The Policy Frameworks Strategy pillar will seek to support the implementation of the national and local policies and plans in Kerry. It will also contribute to the development of new local policies and plans. In light of the COVID-19 pandemic and to ensure the sustainability of this Healthy County plan, a flexible approach to the framework was developed. This consists of a high-level framework which is supported by targeted annual work plans addressing the physical and mental health and wellbeing needs of the population. These annual work plans will be published by the Kerry Local Community Development Committee with support from the Healthy Kerry Committee, the Healthy Kerry Coordinator, local stakeholders and specialist advisors. First up, we're joined by Cathaoirleach of Kerry County Council, Councillor Patrick Conor Scarteen.
Hello everyone, I'm delighted as Mayor of Kerry to say a few words as part of the launch of the new Healthy Kerry Framework. I would like to warmly welcome the contribution of Minister for Public Health, Wellbeing and the National Drug Strategy, Frank Feehan TD. And I thank him for his support for today's launch and for supporting the work of the Healthy Kerry programme. The Healthy Kerry programme is an initiative of Kerry LCDC and is designed to support the delivery of the Healthy Ireland vision and goals in Kerry. A very hard-working committee has helped to bring this framework to fruition. The Healthy Kerry Committee is supported by Kerry County Council's Community Department, which includes the Healthy Kerry Coordinator, Deirdre Hagerty, and committee members Niamh O'Sullivan and Liz O'Donnell. Michelle Stack of the Community Department provides excellent administrative support for the Healthy Kerry programme. I would also like to express thanks to the members of the Healthy Kerry Committee who are key stakeholders in community health promotion in the county. These include members Hilary Scanlon and Dolores McGilligan of the Community Department of the HSE, Ailish Brosnan of the Health Promotion Unit of the HSE, Caroline Toll of the Kerry Public Participation Network, Cora Carrig of the Kerry Recreation and Sports Partnership, and Emer Foley of Munster Technological University. The establishment of this working group has meant that innovative and effective initiatives and programmes have been and continue to be implemented with support from the Department of Health, the Healthy Ireland Fund and Pobal. If COVID-19 pandemic has taught us anything, it is that maintaining a healthy lifestyle in all aspects is essential to all our lives and our well-being. This Healthy Kerry Framework gives us all a sense of important aims and objectives to work towards and build in the years ahead. Elected councillors are fully committed to supporting that endeavour, and I look forward to working with everyone to make this framework a reality in the years ahead. I wish everyone involved in the rollout of this framework every good wish in the future. Thank you.
Thank you, Cathaoirleach. And next up, we're joined by Minister of State with responsibility for public health, wellbeing and the National Drug Strategy, Frank Feehan TD.
Ladies and gentlemen, I am delighted to be with you today to mark the launch of the Healthy Kerry Framework. I would like to thank Deirdre Hagerty, Kerry Health and Wellbeing Officer, Cathaoirleach of Kerry County Council, Councillor Patrick Conor Scarteen, and Chief Executive of Kerry County Council, Moira Morell, for the kind invitation to share this special occasion with you today. This has been a year unlike any other, and never before has health and well-being been so much at the forefront of all our lives. At Healthy Ireland, we want to ensure that everyone gets the opportunity to live a long, happy and healthy life. We want to empower every person to improve their own health and well-being, but to do that, we need to support them to make healthy choices. We need to make the healthy choice the easy choice. In order to achieve this, we need every individual and sector of society to play their part. Good health and well-being is a product of so many factors and requires activating our communities, collaboration across a public, private, community and voluntary sector, organisations, and empowering them to work together to cultivate change. This plan, with its focus on collaborating and partnership, shows a commitment to making this happen. With 7 high-level goals, actions set across 3 strategy pillars, which are healthy communities, well-being in the workplace and policy frameworks. This plan is a roadmap to improving the health and well-being of the people in the area, while also taking into account the changing landscapes forced upon us by the COVID crisis. I am delighted to see well-being in the workplace as one of the pillars of this action plan, and there has been a huge focus on workplaces in the past year, with many having to drastically change how they perform day-to-day activities, and many people now working remotely, and this has become such an important area to be addressed in terms of well-being. My department will be launching our Healthy Workplace Framework in the coming months, which will set out our plan and structure for making our workplace better and healthier places to work. The past year has seen our resilience challenge like never before. Looking after your health and well-being is a vital part of developing and promoting resilience. That is why late last year the government launched the Keep Well campaign to encourage resilience and well-being in the face of the COVID crisis. A key component of the campaign was the involvement and collaboration of the local authorities and Healthy Cities and Counties network. I wish to thank and acknowledge Healthy Kerry and Kerry LCDC and Kerry County Council for all the work and time they've given to this campaign and the huge amounts of initiatives that they have facilitated to help keep the people of Kerry keep well at this time. Today is World Health Day, and this year the theme is around health inequalities. This past year has highlighted the fact that while some people are able to lead healthier lives and have access to healthcare services, others are not so lucky. That is why I am also pleased to note that healthy communities is one of the pillars of this plan. The vision of Healthy Ireland, and indeed Healthy Kerry, is one where everyone can enjoy physical and mental well-being to their full potential, where well-being is valued and supported at every level of society and is everyone's responsibility. We want to make sure that everyone in this country, even the most marginalised in our society, are supported to make healthy choices and to look after their own health and well-being. I very much welcome the goal around building strong relationships in communities. This is so important to help combat rural isolation, especially during this time of COVID, when risks of isolation and loneliness is higher. This is a great example of local people coming together to address local needs and is at the heart of what Healthy Counties is about. This is where the real work is done in our communities, and it is wonderful to see the goals of Healthy Ireland take root in communities all over Ireland. I want to offer my sincere congratulations and thanks to all involved for your dedication, hard work and perseverance, especially during these challenging times. And I look forward to hearing about your progress in the months and years to come. Thank you.
Thank you, Minister. And next we are joined by the Chief Executive of Kerry County Council, Moira Merle.
Hello. Is policy nua an háftaché seo, so chorla chun té agus do winter, Kerry. Tá sé háiteach sláinte agus folána a chur chun cín go háirithe an am seo. I am delighted to welcome the launch of the Healthy Kerry Framework today. And I want to acknowledge the huge work and input of Deirdre Hegarty, the Healthy Kerry Coordinator, and the Kerry County Council Community Department in the delivery of this framework. I want to thank very much our partners in the various agencies across the county and in the community who have made this possible also, and who have been so strong over so many years in developing and delivering practical, strong projects on the ground that help so many in this area of health and well-being. The last year has been a particular year, and it has raised so strongly for us across the country and in the county the importance to people generally of health and well-being, and the importance of us coming together as a county to have a singular focus on this area, which is so strongly supported by this framework. The experience of the community call, I think, has given us many advantages, and that we can see practically of agencies coming together, focusing on this area of community support and health and well-being. There are too many initiatives for me to talk about extensively at this point, but I do want to reference a few to give a sense of the type of work that's happening across the county, such as the social prescribing that's happening with the support of the Listowel Family Resource Centre, work with rural men with the support of the South Kerry Development Partnership, several projects and initiatives done on a partnership way through the Kerry Recreation and Sports Partnership, and over a number of years activity workers have been employed and engaged with hundreds of older people every week across the county in rural Kerry, with the HSE being the lead partner. The Healthy Kerry Framework 2021 to 2027 has been prepared at an important time as we live through this pandemic. And I look forward to the continuation of the work over the years ahead, and I look forward to the continued work and strong partnership with our partners across the county and in the communities and within businesses. And so I wish this framework the very, very best, and I know it will only add so positively to this county.
Thank you very much, Chief Executive. And now we are joined by Hilary Scanlon, Community Work Manager from Cork Carey HSE.
Hi all. As Manager of the Community Work Department in the HSE in Kerry, it gives me great pleasure to be involved in the launch of this framework document, which aims to promote a healthy Kerry, both for people living here and visitors. Like all things, context is vitally important. In 2017, the Department of Health took a decision to fund local authorities to develop health-related projects. It was a major change, and it acknowledged that promoting health is not just the role of the HSE or the Department of Health. I want to start by thanking Kerry County Council for embracing both the opportunities and the challenges involved, and to mention in particular Niamh O'Sullivan, who has guided this process since the very beginning, supported by her colleagues within Kerry County Council and also our own colleagues within the HSE, and later joined by staff from the ITT, now the MTU. The interagency group Healthy Kerry was established, and an application was made for funding. Some very exciting projects were supported to encourage various groups to engage in a new project or try out a new programme provided by the Sports Partnership or Kerry County Council or the HSE, often run by voluntary groups. So, for instance, there was a swim a mile for teenagers, a school mile challenge in national schools, a dance off for teenagers, a cycling programme using electric bikes for older people, a social prescribing project in North Kerry, and finally a targeted health and wellbeing outreach programme for active retirement groups in Kerry. There were also similar projects targeted in supporting better health among children and families, developed by the Kerry Children and Young People's Services Committee, specifically around physical activities and raising awareness about alcohol and substance misuse. From the very outset, We worked on promoting the partnership between the agencies, and we also wanted to ensure we would maximise the return on funds. So we were determined to add value to existing health promotion initiatives through the provision of this fund. Also, to support the health and well-being of the most disadvantaged groups and areas and those experiencing significant health inequality. And finally, to create an environment where every individual and sector of society can play their part in achieving a healthy Kerry. At this point, I would like to acknowledge the work of the current coordinator, Deirdre Hegarty, and previous coordinators and the staff from Kerry County Council who hosted the project and held the governance of the project. Not an easy job. The good foundations laid within the committee proved very useful then when COVID struck. The relationships that were built up and in place helped in the rollout of resources as they came through as a response to COVID. It is worth focusing on the positives that we have here in Kerry that allowed us to, in the Healthy Committee, build on two strong features. Firstly, and perhaps most importantly, in the census of 2016, a total of 86% of residents in Kerry reported either very good or good in terms of their own health, which is amazing. Also, there is a strong and vibrant sense of community in Kerry, and we have a long and proud history of volunteering and community development, and a very strong network of community and voluntary groups working across the entire spectrum, from sport to the environment, from social care to mental health. These groups stepped up to the plate and availed of new opportunities provided by the funds. Perhaps it's worth highlighting in particular the Kerry Mental Health and Wellbeing Fest, which is held every year around World Mental Health Day on the 10th of October. The organising committee is a collaboration between Connecting for Life Kerry, Kerry County Council, the HSE, North East West and Kerry Development, SKDB Partnership, Kerry Mental Health Association, Jigsaw Kerry, IT Tralee and the Kerry Volunteer Centre, a whole range of groups. This now features hundreds of events and really demonstrates what can happen when groups come together. It adapted and went online in 2020 and was a huge success despite COVID. The funds provided under this programme allowed investment across the county and the promoting of health projects across the full life cycle and the generations. Ideally, the projects will be mainstreamed with core funding, some of which has already been achieved. It is indeed timely as we continue to deal with COVID in our homes, in our workplaces and in our communities across the county that this framework is launched today. The relationships that were developed by the agencies helped in developing the Kerry community response to COVID, and perhaps it is no coincidence that Kerry has been fortunate in keeping the numbers so low for the past year. Many agencies have pulled together, both statutory and voluntary, to respond to this major pandemic. Looking to the future, this framework has three specific themes: healthy communities, wellbeing in the workplace, including remote working, and policy frameworks. Based on our track record of working together to promote the health and social gain of all people living and working in Kerry and visitors alike, I am hopeful, despite all the challenges that we face, that we can plan for more investment in health and produce positive health outcomes. Finally, in the context of COVID, it is important that we hold firm. Gur míle maith agaibh agus cumad slán.
Thank you very much, Hilary, for joining us today. The Healthy Kerry Community Wellbeing Initiative will seek to improve the health of communities in Kerry year on year through, firstly, awarding the Healthy Kerry brand to communities that demonstrate support for health and wellbeing, and secondly, providing further recognition to communities that demonstrate best practices. Building healthy communities is one priority area of the Healthy Kerry Framework and was previously highlighted as an action in the Kerry Local Economic and Community Plan. The first stage of developing this initiative is to identify and highlight community-led initiatives that support health and wellbeing among various population groups, locations and settings in Kerry. Kerry County Council and Kerry Local Community Development Committee has secured the €30,000 Community Mental Health Small Grant Scheme from the Department of Health's Mental Health Unit to pilot the Healthy Kerry Community Wellbeing Initiative among local, community, voluntary and sporting organisations. The groups that have been selected to pilot this initiative have promoted and supported the health and wellbeing of their community previously and proposed projects that seek to support their community's mental health and wellbeing from April to October 2021. We are now joined once again by the Cathaoirleach of Kerry County Council, Patrick Conor Scarteen, who is going to announce the groups that have been selected to receive these grants.
Hello everyone. The groups that have been awarded the Community Mental Health Small Grant Scheme are as follows. Number 1, Knocknagashel Over 55 Social Club and Women's Group CLG. Number 2, Acquired Brain Injury Ireland. Number 3, Main Valley Family Resource Centre. Number 4, Laura Community Centre Committee. Number 5, Carsiveen Social Services. Number 6, Kerry Diocesan Youth Service. Number 7, East Kerry Mental Health Association. Number 8, Ballybunion Community Forum. Number 9, Kerry Women's Resource Centre CLG, trading as Phoenix Women's Centre. And finally, number 10, Arthritis Ireland Kerry Branch. We are delighted that these groups have been selected to pilot the Healthy Kerry Community Wellbeing Initiative from April to October and will be supported by the Healthy Kerry Coordinator and the Community Mental Health Small Grant Scheme. These projects were selected as they align with the high-level goals of the Healthy Kerry Framework, the mental health theme of the Healthy Ireland Fund, and seek to improve community mental health and well-being and tackle loneliness and isolation in Kerry. The details of these projects will be available on the Healthy Kerry and Kerry County Council websites shortly. Thank you.
Thank you very much, Cathaoirleach. That concludes our launch today. Thank you very much for taking the time to join us. We hope that you found this video informative and we look forward to taking the journey with you to achieving a healthy Kerry for us all.